Hello everyone, welcome to Masterclass about medical cannabis therapy and this fantastic combination of traveling to Italy, to Sicily, and to get this uh, quite fruitful and important treatment. This masterclass held on during Health Tourism Business Summit. Sorry, a bit tired already. And I would like to introduce you our speaker. This is Dr. Privitera. Dr. Carlo, hello. This is your time. Please present these possibilities, which
Good
tourists
evening. Hello. Thank
all
you.
over the globe can get from you. On the end of this meeting, everyone can switch, turn on your microphone and give some question to Dr. Carlo, please.
Okay. Good evening to everybody. Thank you to Natalia for this masterclass. I'm Carlo Privitera. I'm a doctor. I studied as a surgeon and from sorry since 2015 I start to use medical cannabis in all the field of application we know by the scientific international literature. So here in Italy, I start in 2016 with Progetto Medicum CAMIT project that is a standard method to apply the medical cannabis for patient for different kind of pathologies. We operate in team. We are a medical doctor team on your left, and in the scientific board we have two pharmacists that allow us to personalize all the therapies for a patient. The main concern when we speak about medical cannabis and the reason we can treat different kind of pathologies is inside inside our body, because normally the endocannabinoid system works daily in all our life to allow us to adapt our body and all our cell activity to the stress, meaning the complex of stimuli that act on our body daily. So normally we can adapt to the stress, adapt ourselves to the stress thanks to the activity of endocannabinoid system. But in all the chronic pathologies, we know that endocannabinoid system doesn't work. So that's the reason because we can use medical cannabis in pain treatment for neuropathic pain, oncological pain, traumatic pain, and so on. In the neurological problem and in neurological disease, in epilepsy, in the inflammatory bowel disease like Crohn disease, in fibromyalgia, in the neurodegenerative disease, and so on. Especially is important that the result we can reach in rheumatoid arthritis and psoriatic arthritis, both with a combination of topic and systemic therapy. as I said, in all these pathologies, we know, we found that endocannabinoid system doesn't work. So when we start a path in which we have to personalize the therapy, we have to we start to manage the patient in the same way the endocrinologist makes with diabetic patient. What I mean that what we have to do for each patient is to change, to supply the endocannabinoid system respond when it needs. It means we have to find the space between the stressor and the biology of the patient, the clinical response of the patient. So in this path we can personalize all the therapy, and we mean medical therapy, behavioral therapy, and food alimentary therapy. For this, we and in Bookismet channel we propose 4 different paths: pain relief, immunopath, brain gut, and no stress. The difference between these are inside is inside the path in that or we start with the initial placement of the patient, and then with him we plan a nutritional and therapeutic path. When the patient arrive in the structure, we can supply all the logistic about the drug and food supply. So we can manage patient in villas or in an hotel. Is the same thing. And after the path, after the week, the period he stay with us, we can go ahead with follow-up with the remote patient monitoring. So in the different path, we have different nutritional plan, different product for massage and manual therapy, and the personalized therapy, drug therapy with medical cannabis and integrated therapy. That case by case we study for each patient. And the for path I already said. We how we manage, I already said. We now make it by remote by phone, but the advantage to have the patient in for 1 week is to have the possibility many combination of drug and to accelerate the process of the personalization of the therapy, and that's it. Some question, something else?
Thank you, Dr. Carlos. So prompt presentation.
Where is possible to do? Where is possible to have a treatment?
Okay, we now can manage outpatient. We now can manage outpatient services, and we can help the patient to for the other services. But we are starting a process in a couple of hotel in Italy, some villa in Syracuse, outpatient clinic in Catania, and we are starting a process in Calabria, in Soverato, in an hotel, and in Latina, closer to Rome.
Okay.
How to get your personal consultation? Please explain. I know it is online possibilities and offline also.
Okay, we can about offline in outpatient way. We are in Catania now. That is closer to airport and easy to reach. For the single consultation, the amount is 180, around 200 euros. And if the patient take the path before the consultation is online, so we can make just the consultation or both together.
Thank you. Colleagues, do someone have a question?
I think we are okay.
Everything clear?
Yes.
Oh.